Away from the noise of the playground, a debate is taking place. COVID infections are rising among primary school pupils, and parents who've had the vaccines themselves have varying views when it comes to their children.
I don't see the point, the reason being they don't tend to have strong symptoms.
If it's helping them to keep safe, then I would say yes.
It's not bad, it's good because it helps the virus go away.
We haven't seen any evidence as a reason why it wouldn't work or why it would pose that many risks.
The discussion around whether to vaccinate our primary school children comes as new data show 11% of children aged 2 to 11 tested positive in the last week. That's up from 5% on when children went back to school after Christmas. Compare that to the over 70s, where the infection rate has dropped to just 2%. A decision about whether or not to vaccinate our younger children is one of the more complex public health officials will have to make. It would normally take them years, but in the context of the pandemic, they're having to weigh up evidence as it emerges.
Vaccination prevents hospitalisation, severe disease and death. Those are the facts. It doesn't prevent infection. And in this age group, hospitalisation, severe disease and death is thankfully extremely rare.
But some places have begun vaccinating children in this age group, with evidence from those countries suggesting perhaps that the jab reduces a rare inflammatory reaction caused by COVID in children.
If that's true, then I think that's a really good motivation to vaccinate this age group, because that's the reason as a paediatrician I'm most likely to see a child who's had COVID in hospital.
But this SAGE expert points to other practical considerations when it comes to vaccinating this age group.
We need to be vaccinating children in a place of safety by staff who are trained to vaccinate children, who are trained to protect children, as safeguarding protections we put around children. It will be costly and it will displace something. Nothing ever occurs without displacing something else.
For scientific advisors and parents alike, this is one of the toughest calls of the pandemic. Vaccination may bring benefits, but with so many children already infected with COVID, the question is whether these benefits outweigh any potential knock-on effects. Deborah Cohen, News at 10.